Is there an age where PRP doesn't work as well, or why, with the tissue or the concentrate or the biologics that you're working with?
Not as much for PRP as for the bone marrow or the cellular, like stem cell treatments. The main reason for PRP, as we get older, the growth factors in our platelets decrease a little. And I like to say, it's not so much that they decrease, but they get a little weary. But the device concentrates those platelets. So in somebody who's older, I just dial up the concentration. So someone like you, I might do, let's say, a 7 times baseline PRP to your rotator cuff. Well, someone who's older, I'm going to dial it up to 8 or 9. So it's a concentration. It's also the absolute number of platelets. So I want more platelets in someone who's a little older, so I just change my device settings. So that's easy.
So why wouldn't you just, I would always think more is better. So if someone my age and you said, oh, you wouldn't do as high concentrate, I want 11, I don't want 8. But why is that I wouldn't want that higher concentrate? Is the inflammatory response in me and will handle that?
Exactly. There's been a few studies that show if you get concentrations above 10, there's some deleterious effect, but they're not the greatest studies. So there's a dose response curve. So in general, the more platelets, the better. But there's a happy medium there. And the biggest issue is that you're turning on inflammation. And how much do you need to make something better? You can keep dialing it up, but the interim discomfort the patient is going to have may be unbearable. And for certain things like a shoulder, if they hurt so much they don't want to move it for a week, that can have consequences down the line. So it's this delicate balance. And after having done this as long as I have, you sort of know. So let's say somebody has Crohn's disease and they're on a biologic, so that they're generally very hyper-inflammatory. And as long as they're still on their biologic, you can treat them like a normal person. But let's say they come off it for some reason. Well, they're going to be super sensitive, right? Where somebody else who's older is not as sensitive. So the device that I use, I love it because I can change that. And I can change it based on my experience. And I can only tell you that that's kind of where experience matters. I mean, this is a biologic, okay? And as an organism, the patient's an organism. And each organism, patient A, patient B, they all are different. So you have to have the experience to kind of know, not to kind of know, but to know. You have to have the experience to know what's going to work best in that patient.